Hello everybody, my name is Mike Andrews. I'm a Service Manager with the Care Inspectorate. Thank you very much for coming today. The purpose of our session is to support nurse agencies to fulfil their responsibilities as registered regulated care services. And the reason that we wanted to do this is because we're recognising that the number of nurse agencies has increased significantly in the past couple of years. And we also recognise that not all nurse agencies engage regularly with the Care Inspectorate, and not all nurse agencies are based in Scotland, so therefore our requirements are different to other parts of the United Kingdom. So we have 3 speakers for you today. The first is Mary Owen. She is the team manager of the registration team, and she's going to speak to you about registration and the variation process. Secondly, Sharon Reynolds, who is the service manager of the methodology team, and she's going to provide information on our quality framework for self-evaluation and improvement support. And finally, we have Daniel Stoddard, who is a team manager within the inspection teams, and he's going to discuss the completion of annual returns and notifications to the Care Inspectorate. We have put in, hopefully, some time at the end for some questions and answers, so if you can hold off your questions to the end, we would appreciate it. So without further ado, I will pass over on to Mary.
Thanks, Mike. Welcome everybody, and thank you for joining us on this presentation. Can we slip to the next slide, please, Anthony? Thank you. Okay, so today I'm going to talk about registration and what's relevant for yourselves as nurse agencies within the registration and the variation process. You all have a certificate of registration. You have been through our quite onerous registration process assessment steps, and you've now got your certificate of registration. This certificate of registration, thanks Anthony, needs to be displayed within your service provider's address. It must be displayed as part of one of our requirements. Each service has been given your own care service number, so your CS number. The CS number is unique to each care service, and it's identifiable for us within our Care Inspectorate systems, and within that all aspects of scrutiny and assurance. If you, for example, have got a new manager or are going to get a new manager, you need to let us know. You need to have a discussion in advance with your case holding inspector and update us through the digital portal through what we call as a notification. And once that is accepted, that is then put into your new certificate, and again that must be displayed. Because you are a non-premises based care service, if you have a change of address, it will again go through a notification, through a discussion with your case holding inspector, and updated through our digital portal. As Mike has already said, a number of nurse agencies are based out with Scotland or new to the Scotland care sector. So what we ask that you have a protocol on how you will ensure that you are available for regulated activities such as unannounced inspections, complaint investigations, or any other regulated activity. Your registration inspector should have spoken you through this, but we ask you to have that available and accessible for your inspector. Thanks, Anthony. Next slide. So within your registration certificate, everybody has a condition of registration. These conditions of registration are placed for each service type as defined in our Public Service Reform Act 2010 Scotland. And this one is for nurse agencies. Now, these conditions can be personalised to each provider. So they are unique to each service, and they're unique to each care service number. But some standard kind of example ones are to supply and introduce nurses to, whether it be NHS, whether it be care homes, or whether it be a mixture of both. Another condition that we tend to have is any staff member who is placing nurses must be a registered nurse or midwife. And the person who's placing the individuals must have the relevant qualifications, skills and abilities to do that. We also ask when nurses are working in a service as a registered nurse, they must be a registered nurse on call for the agency whenever the service is in operation, so to have an on-call system in place. We also ask that the service is responsible for nurses being placed by them to make sure they are registered and their registration is with NMC and that the revalidation is done as per their NMC requirements. Now, some services, if they are new to Scotland or if they're a smaller type service, may have a location of service delivery within their conditions of registration. So the example we've put up on the screen today is the service will provide care within the Central Belt, Borders and Highlands. So it's set in a location. If your conditions of registration change, we need to have a conversation about this, and we need to have a submission through our variation system. Anthony, next slide, please. Thank you. So the conditions of registrations are your parameters of your service provision, and these should be adhered to at all times. Once a care service is registered and operating, there's only a few ways that you can change or add or vary or remove conditions of registrations. There's three main ways. One is that we, as the care inspector, as a regulatory body, ask that conditions should be attached, removed or varied, and that's through enforcement action. The second way is we can give you a notice of an emergency condition notice, which puts a new condition on your registration, which takes effect immediately. And the most standard one is you apply for a new condition or a condition to be removed, to vary a condition, through our online portal. However, please be aware that if you are found to be in breach of your conditions, we can go down formal measures such as enforcement action. However, what we would want to do is for all nurse agencies to work within the parameters of their service type. So, as Mike's already said, a number of our nurse agencies are new to Scotland, and you would have found the registration process very different from other parts of the UK. We have a very different registration process, we have different health and social care standards, and Shan will talk about our specific nurse agency quality framework later on. It's imperative that you work within your conditions of registrations and you're actively aware of the differences in our regulations and legislation, and that from different parts of the UK. What we then can do is talk about variations and notifications. Thanks, Anthony. So a notification is if you want to tell us something, you're notifying us something, and this is done through our digital portal. There's going to be a theme throughout the presentation, and that is linking with your case holding inspector. That is really essential as it opens communication with your inspector, and it also gives a good relationship development with each other. So notifications, I'm very aware that Daniel is also going to be talking about notifications later on. So the ones I'll be talking about are only linked to registration. Okay. So notifications such as change of manager, change of relevant individuals. So for example, change of a committee member, change of a director as part of the legal entity. All of these things can be done through a notification. Variations. Variations are your variations of your conditions of registration. So unless it otherwise agreed with ourselves, the variation is to take effect no earlier than 3 months after the date of application. As a provider, you can only submit one application of variation at a time, and we can only assess the application of variation that you've put in. Again, if you're going to submit a variation, have a conversation with your case holding inspector first. Have that discussion, because sometimes that's the best way to go about things. Once your variation is in and it's then been assessed, it will be passed over to a member of our registration team. They will then assess your variation. They will then carry out our assessment steps, very similar, but very small version of what you went through for your registration process. And they may ask for follow-up information, they may ask to meet with you to discuss, and they may ask for supporting documents to evidence the variation should be granted. Your variation can be granted or refused, similar to our registration process. If you are wanting to change or expand your service, for example, if you are going into a new service type, you must submit a new application for the new registration. Next slide, please, Anthony. Thank you. So as I said, you must submit a new application for a new type of registration. So if you're expanding your service delivery type, if you're going to go into care at home as well as nurse agencies, or you're going to develop a different type of service, it must be a full registration you submit. We also do cancellations of services. What again we would say is link with your inspector, and again there will be 3 months notice that's required within that process. We also have an inactive services policy, and this is a policy that we've adopted to allow a service to stop operating for up to 12 months without having to cancel their registration. This is something you have to request and it has to be granted. But where that service is granted an inactive status, this could be for reasons such as a refurbishment of premises, or the provider has caring responsibilities, or maternity or paternity leave, or the provider has health issues. There may be other occasions that other circumstances will be considered, but we would do that on an individual basis. But inactive service policy is a good thing to have, that we can put on hold a registration for 12 months. Change of legal entity. Now, this is one thing that always confuses people, even my colleagues within the care inspectorate. If your nurse agency is sold or is bought over by another company, you will need to complete a full registration as the new company. So the full registration must be submitted, assessed and granted prior to the sale or transfer happening. At the same time, the current provider will also request a cancellation at the assessment stage, but this is not implemented until the new registration is granted. Next slide, please, Anthony. Thank you. This is the notifications, notifiable events guidance that you all will have been sent with our registration team, but it's also available within our website. And this will guide you for notifications, variations and cancellations, and anything that's linked to you contacting us that's relevant for registration and variation and for inspection purposes. Thank you very much. I'll now pass over to Sharon, I think.
Thanks, Mary. So I'm going to just talk to you a little bit about our quality framework and self-evaluation toolkits that we have. So some of you might have already seen this information that we have. We did a webinar when we first launched our quality framework last year. So some of you may have already seen some of this in more detail. So the framework itself was primarily a tool for self-evaluation. All of our services have these frameworks and they're mainly linked to different registration types. So we have separate ones for care homes, care at home, housing support, and various different ones for childcare and early learning. So there's lots of different ones, so it's always worth checking that you're using the right one initially as well. All of our frameworks have been designed with people that use services and also providers. So we've done lots of consultation around what's important for people that use services and also to people that use services. And then we've consulted with providers about whether that reflects what their service actually looks like and how their service operates, and then tested these out in practice. So some of you may also have been involved in those tests when we did the agency ones, which will be a couple of years ago now. So the frameworks themselves, they bring together lots of different information. So whether that's legislation, good practice, the health and social care standards, all these different pieces of information and guidance that we expect to see in practice, it brings them together in what we call quality illustrations. So it gives you an idea of what that would actually look like in your service. They're all outcome focused and, like I say, developed with people. They are quite aspirational in some areas. They are based in human rights, and they also support that openness and transparency. We're very much giving you the standards that we expect to see in services, but also the standards that we expect that you are making your own judgments about and evaluating yourselves against within your service. Thanks, Anthony. So the setup of the framework can be quite complicated. This big grid that you see, that's our key questions. So we only have 2 key questions for nurse agencies. For those of you that have seen some of the other frameworks, we have the full 6 questions. And one of the things that's worth noting here is that we have key question 1, 2, and then the bottom key question 6. So all the other frameworks have key questions 3, 4, and 5. Some don't have 4 because that's relating to the setting. So again, it depends on the service type. But we want to keep that integrity of the intelligence by keeping the numbering the same, which is why we skip over some of the questions. And also, I think it's very confusing for both providers and inspectors when they're working across different service types if we change the numbering around. So you have key question 1 and 2. And that's our main focus. Those are the things that we're going to look at when we're coming out and inspecting you, and the things that we expect that you're self-evaluating against. That key question at the bottom, the overall capacity for improvement, that's something that's not formally evaluated. So we don't give you a grade for that at the moment. That's about us looking at, people's capacity for improvement. What are the risks in terms of outcomes to people? So that's something that we use to support our judgments. And we have a POET tool, which stands for Proportionate Outcomes Evaluation Tool. And that's to help inspectors look at whether a service is, able to understand what some of the issues are, if there are concerns raised, and how does that balance up against the risks posed to people. And sometimes that supports whether we make an area for improvement, whether something needs to go further, whether there needs to be a requirement in place to support that improvement. So like I say, we have these 2 key questions overall. And when it comes to your inspections, both of those key questions will be used at all inspections. So you can see here that we have what we call quality indicators. So each of these quality indicators sits under one of those key questions. And the example here is 1.2, so that's around people's health and well-being. Under every quality indicator, we then break it down further into key areas, which are those little bullet points underneath that. And then all of those illustrations that we see, so the bulk of the kind of text there, is about what those key areas look like in practice. So what does that mean for people? Everything is very outcomes focused as far as possible. Obviously, processes by their very nature are going to be in there, and there's lots of things around nurse agencies that are quite process driven. However, we have matched those to outcomes. So for example, we talk about people's health and well-being, and a lot of people struggle with that idea of, that grand outcome for a nurse agency, because often you don't have a lot of control over that kind of final user. But there's things that we can say, for example, like somebody's health and well-being may not be as good as it could. They may not have that positive outcome if a service hasn't done a proper assessment. So maybe the nurse isn't appropriately matched to meet that person's needs. So you know right from the beginning that the chances of positive outcome would be quite poor. So we have linked those processes to outcomes. Next slide, please, Anthony. Thanks. So for everything we talk about in the framework, we give you guidance or places to find, where that came from. We're not just making things up here. This is, like I say, all based in health and social care standards, in legislation, in other guidance. At the end of every quality indicator, we have these scrutiny, improvement and support toolboxes. So you can see there's a little link on those. So when you click on that link, it takes you to a page on our hub. So from there, you can get all the live links. It used to be that we just used to print them out on a page, but obviously then links change very quickly. Whereas having this virtual toolbox now, we're able to keep those a little bit more up to date. So everything has a live link. Obviously, if there are links that get broken, just drop us an email and we can fix that. We also give you ideas about how we might assess that, and therefore how you could self-evaluate against that. So if there's a particular illustration, we might have conversations with people. We might have conversations with your staff. We might have conversations with people that use your service. For example, it may be, ward sisters or something that have a lot of your agency nurses in them. It might be managers of care homes that, again, use your service a lot. It might be that you provide support to people in their own home, and it might be directly them that we're speaking to. So we speak to a range of people to get feedback about their experiences of what your service offers. We might also look at paperwork. So there you can see we give the example of we might sample different policies and procedures that you have, or minutes of meetings you've had, maybe feedback that you've gained from people. You may be using surveys or something like that. And also things you should consider, how things interact within your service, questions that you need to think about when you're making that assessment of, how are we doing in this particular area. Next slide, please, Anthony. So our core assurances, so these are at the front of the framework, and these are more of a tick list. That's how they kind of look. So these are the things that we look at on every inspection and always have done. These are the basic things that we say are really key to keeping people safe. So these are things that are really quite basic. They're not as aspirational or anything as some of the other things. They're not necessarily tied up to outcomes in the same way that some of the other illustrations that you have are. But these things, like I say, are the real key things that we say have to be in place. And that's about designing in good outcomes into your service. So some of these are quite process-based things. But again, we don't want good outcomes happening by chance. They need to be part of how your service is built and how you ensure that you continue to provide those good outcomes for people. So there's quite a different list, and we've had really positive feedback from providers across different service types that this has been really helpful for them to see what it is that we're looking at when we go in on inspection, and give them an idea, again, supporting that openness and transparency of exactly what the expectation is that they have in place. Next slide, please, Anthony. Thank you. So just to bring that together a bit, like I say, the framework itself is primarily a tool for self-evaluation, but to support that further, we've developed toolkits for all different service types. This list here is from our website, where you can go in and view a number of different documents that we have. So we have things like a worked example. So we show you kind of step by step what a self-evaluation might actually look like. We give you some blank tools as well, so that you could use our tools if you wished to self-evaluate yourself against our framework. We don't say that you have to use our tools. Obviously, it's entirely up to you how you complete self-evaluation, but we do expect that you're doing it. And actually, part of our core assurances is looking at improvement planning, and that you might call that service development plans. Sometimes people have different names for them, but whatever that is, that shows that where your service is at. Where is it doing well? Where are there areas for improvement? How do you plan to address those areas for improvement? So again, you don't need to use our tools, but you do need to do that process within your service. It's around that good quality assurance. How are you making sure that what you're delivering is of really good, high quality, and that you're meeting the needs of people and ensuring those good outcomes are actually happening in practice? So again, we have some examples. We have some templates there around questionnaires. So what are the kind of things that you might ask people that are involved in your service? And we also have some guidance in there as well. All the templates that we have in there are in Word documents, so you can download them, you can adapt them. You know, our advice is don't just use what we've put there. They are there to guide you as to the kind of things you might want to ask or look at. But it's going to depend entirely on your own individual service type as to what that is in reality. But you can just amend those based on our templates. So all that is there for you to be able to use and have a look at yourselves. Okay, thank you. So I think I'm going to be handing over now to Daniel.
Morning, thank you very much. Anthony, I wonder if you're getting bored of people saying next slide, please. So we need a code for you to move on. So what's your favourite cake?
Cheesecake.
Cheesecake, excellent. All right then. So I'll use cheesecake when I want you to move on. There are 135 nurse agencies currently registered in Scotland, and about March last year we carried out a piece of work to look at how nurse agencies were operating, where they were operating, and we found that only about half of registered nurse agencies had an up-to-date annual return. And I think there are a number of different reasons for that. So Mary mentioned earlier that there's a number of nurse agencies that are based out with Scotland. So about 10% of nurse agencies operate and are based outside Scotland, but operate in Scotland. And I think another factor in that is the pandemic, because during the pandemic we rearranged how we were carrying out our regulatory activity. Case holding arrangements were different, so a number of service types didn't get the same kind of level of attention and interaction with us as a regulatory body during the pandemic. So part of the motivation for today's session was to support nurse agencies to become more familiar with their obligations and responsibilities as regulated services. And one of those core elements of your responsibilities is about the completion of the annual return and about notifying us of significant events. Cheesecake, thank you. Anticipated, Anthony. So there's a page on our website dedicated to annual returns. It's got lots of useful information and some information for you to refer to. So it's dead helpful from that point of view. Cheesecake. Thanks. So why do we want an annual return? I suppose the first reason is that under the legislation which gave rise to the Care Inspectorate, the Public Services Reform Act, it says that care providers must supply us with information about services that we need in order to carry out our regulatory activity. So the information that care services provide us with through the annual return helps inspectors prioritise, helps us understand the service, what's actually delivered and to whom, the size of the service, and that helps us plan our inspection activity. But in addition to that, the annual returns give us good data, which helps us and government understand the sector and understand some of the issues in the sector. And we also publish some of that data when it's been analysed. So information about like staff vacancies across the sector, it helps us understand certain pressures on the care sector, staff turnover, that kind of thing. So that's why we want to encourage all care services to submit an annual return by the deadline. I think a number of things to say is there's no flexibility about the deadline. So once we've set that deadline, that's what you need to aim for in terms of completing that. We've given providers an extra 4 weeks this year in order to kind of accommodate some of the pressures on the sector. The only way to submit your annual return is through e-forms. So there is no other way. You can't kind of submit it by email or anything else. It's got to be through e-forms. So if if there's been a change of manager, or if you don't have an e-forms login, you need to contact the contact centre and get that resolved. Get new log information in order to be able to interact with e-forms in order to submit your annual return. Also on the website is a really helpful frequently asked questions section, and it takes you through a number of different kind of scenarios, technical issues, and that kind of thing to support you to resolve those. Quite a lot of the answers is about contacting the contact centre to help resolve that, but I would also encourage you to contact your case holding inspector as well to support you to complete the annual return accurately and completely. So thank you. As inspectors can't see what it looks like from your perspective on completing e-forms, so we view the information that you submit through something called RMS, which is our kind of in-house regulatory management system, and that's what the annual return looks like to us as it starts to come through. So you just complete it section by section and work your way through it. It's relatively uncomplicated, but I'll pick out a number of kind of specific bits that we want to make sure that you give your attention to, that are particularly relevant for nurse agencies. Thanks, Anthony. So in relation to that question under service description about the supply of nurses or the introduction of nurses, so those are the only two kind of functions that we regulate in relation to nurse agencies. We particularly want to know if you supply nurses or if you introduce nurses. A number of nurse agencies also supply healthcare assistants. For example, the Care Inspectorate has no regulatory role in relation to healthcare assistants or any other staff supplied by nurse agencies other than registered nurses. So that's just a kind of oversight in the legislation, that the supply of healthcare assistants or care workers isn't regulated if it's done through a nurse agency. Cheesecake. There are some slightly irritating things about the annual returns, which we're going to try and fix for next year, specifically for nurse agencies. So nurse agencies might supply to NHS boards, might supply to care homes, might supply directly to people in their own homes. But this section about the supply of nurses is, you need to go through and say for each one of those kind of the demographics around the delivery of support to individual people. It would be much easier if you could just kind of select, we supply to NHS boards only, or we only supply to people in their own homes, or all three. The other bit that irritates me is the section around geography. So please tell us all local authorities, health and social care partnerships which buy places or services. That's not really suitable for nurse agencies. We're interested in where you supply in terms of geography. We're interested in whether you supply to NHS boards or to care homes or to individual people. So for this year, it would be really helpful if you could complete that section in relation to the areas where you supply, and that helps us know where best to locate your service in terms of allocating it to an inspection team. And then next year, we'll endeavour to have those questions revised so that they're more applicable to nurse agencies. The other section that is a wee bit onerous is around staff details. So you have to individually input the information for each staff member. If you put in information and save it, you can't delete it once it's created. So then you have to go into the you have to open up the created in error section. Sorry, you have to open up the individual staff member section and then check the created in error box in order to tell us that we should ignore that line. So it's a bit onerous if you've got a large number of staff to input each staff member's name and details, but by giving us their start date and the date they've left, or if they're still with you, that helps us to generate data around staff turnover. We use that in terms of our inspection activity, because we would regard higher turnover of staff as an indicator of increased risk, but it also tells us, gives us information about the challenges of the sector as well. The other thing that's slightly irritating is the whole time equivalent calculation. We used to include a helpful calculator in there, but we no longer do that for some reason. So incidents, we want you to tell us in the annual return about the total number of service user incidents over the course of that particular period. But we also want you to tell us, in fact, we require you to tell us about other incidents that occur as they occur, and give us information about your management of those incidents. So I'll move on to talk about those. It's a handy segue into talking about notifications. So our guidance in relation to notifications is contained in this document, which again you can also find on our website. It's called Records That All Registered Services Must Keep, and it does exactly what it says on the tin. So it tells you what records you need to maintain and to keep within your service, and we might want to look at some of those when we carry out inspections. But it also gives you information about what you need to tell us about and when. Cheesecake. So I'm not going to go through the whole thing because that's laborious and annoying. So I'm just going to pick out a number of the notifications that we would pay particular attention to. So whenever there's an accident or an injury involving somebody who's using your service, you must tell us about that. You must tell us about that incident within 24 hours. It's got some definitions about what we regard as an accident and what we would regard as an incident. There's still scope for interpretation within that. And if you're not sure whether or not you should report a particular occurrence to us, report it rather than don't. Err on the side of reporting. And then if your case holding inspector feels that you're telling us about stuff kind of unnecessarily, then they'll let you know that and give you a bit of guidance about kind of calibrating that more closely. The other notifications that we would regard as really significant are in relation to allegations of abuse in relation to a person using the service. So wherever you make an adult support and protection referral to the local authority, so whenever you suspect that harm has taken place or harm has occurred, you must also tell us about that using this notification. Ideally, I would like this notification to specifically refer to adult support and protection, but it covers both adult and children's services. So just to be clear, if something happens in relation to the service that you're providing where somebody's placed at risk of harm and you tell the local authority about that through an adult support and protection notification, usually an AP1, you must also tell us that you've done that. And if that harm is alleged to have been committed by a member of staff that you employ, then you must also complete an allegation of misconduct notification. So the two sometimes go hand in hand, but you must tell us about both of those. I think Mary might have touched on some of these. So the absence of a manager, you need to tell us if the manager is going to be absent for more than 28 days, and tell us what arrangements you've got in place to operate the service in the meantime. And the increase in numbers of staff relates sometimes to conditions of service, to conditions of registration. So that's quite often an element of the registration conditions about telling us around the numbers of staff that you employ. I think that is the end of my section. So thank you for your rapt attention.
Thank you, Daniel, Mary and Sharon. Does anybody else fancy a bit of cheesecake now? It's a bit weird. Anyway, I suppose I've just got
Mike.
A couple of things just to reinforce. Importantly, in all of that, if you have any questions, please contact your case holding inspector. And something I have to say in terms of failure to complete your annual return or pay your fees, that can affect your evaluations, your grades that you're awarded at inspection. So please be aware of that. Importantly, if you haven't used the eForms system or you're not familiar with it, please spend the time doing that. Because as Daniel rightly said, we get to the middle of March. So if you haven't completed your annual return, you've missed the deadline, and that's that. I suppose just one thing I noted down was please make sure your contact information is correct on eForms as well, so that if you're contacting us or we need to contact you, that we're able to do so. That's all the notes I had written down. Would anybody like to ask any questions? Thank you, Esther, for sticking a couple of things in the chat. You don't have to ask any questions. Oh, Simon, thank you for coming in.
Oh, you're welcome. Just briefly, as a nurse agency, we employ quite a lot of nurses, which who go to Scotland on typically lines of work. We're based down in London. We have an office up there, which is useful, but to be honest, it's more for general admin really than anything. In terms of the annual submission, adding 150 different nurses' details to the staff information would be a supremely onerous task. Where we've had recent inspections, we've provided a full spreadsheet of all the nurses, their training, their first shift, last shift, etc., etc. Would this be deemed acceptable moving forward?
I'll answer that, but if any of the care inspector staff want to jump in, I think the expectation is that you complete the eForm. You complete the annual return through our eForm system.
Yeah, if you've ever done the staff details
I have
information,
many years. I have previously.
On there, it's
glad to say I don't have to do it anymore.
It's not great.
It's not intuitive. We completely appreciate that, particularly for larger services.
Yeah.
Mary's come on the screen. Do you want to add in there,
Hi,
Mary?
Mary.
Hi there. I'm actually relatively new to the Care Inspectorate, so I'm only here 7-8 months. So previously I was a provider, and previously I understand the frustrations of inputting everybody's information. What I will say is your first year of completing your annual return is probably the most complex, because you're actually submitting information. It then pulls through previous information for previous years. So yes, it will be a very onerous task the first time, but it'll be worth it in the end.
Well, you say that. I mean, we've been supplying there for over 5 years and have done annual reports. Initially, with sort of low numbers of staff, it was straightforward. Yes, you're right.
Yeah.
But all of a sudden, we've got a large requirement, and we are literally churning nurses up there on short-term lines of work and things like that. It's just to keep track of it all on the eForm system is a real challenge.
Yeah, and as a provider, that is one of our responsibilities, to ensure that the information for the Care Inspector is up to date and correct. So unfortunately,
which is why we're providing a full breakdown on a spreadsheet to the inspector.
Okay. Simon, I'm going to say to you, I know that I feel your pain.
Yeah.
The expectation is that you complete the eForm and you return as per everybody else. And bear in mind, there are lots of other very large services with hundreds of staff who do the same thing. As Mary says, it's the pain of doing it the first time.
Okay, thank you.
It's not the answer. It's not the answer you want to hear, but unfortunately,
it's not. No,
okay.
Not at all.
Thank you. Thank you for asking, no, Simon.
I would probably just add in that as well, Simon, because I appreciate it. You know, it is very onerous. But that the annual return actually, you know, does other things in the background as well. So that information does contribute elsewhere, which is why you can't just attach it. And one of the other things I think is worth mentioning just in general is that we are looking at overhauling kind of our whole sort of systems in terms of how they can be more supportive. So that's definitely something that we can take back in terms of being able to use different attachments or different ways of collating that information going forward. So we can certainly take that feedback.
Which is why I raised it. Yeah, definitely. Because if it was more straightforward, we could just go, oh, great, here you go.
Yeah.
Oh, yeah. I mean, that would be wonderful. But unfortunately, like Mike said, we're in the position we're in at the moment and we can't really do much about that. But we definitely take it on board and can pass it over to our business transformation team, who will be taking some of those changes forward in the future.
Please, I'd suggest that's quite an important one for anyone who's got a lot of nurses.
Or a lot of staff. Absolutely.
Well, yeah, a lot of stuff. Yeah, I mean, staff doesn't really change. I mean, you know, putting staff on there is pretty straightforward, but it's all the nurses we're providing as agency workers, which that's where the challenge comes in.
Okay. Thank you, Simon. And thank you, Sharon. Julian? Is that how I pronounce your name?
Julian. Hi, everyone.
Oh, my goodness. I can't see the J. I thought it was something. Oh,
no, it is spelled with an I.
Oh, sorry. I beg your pardon. Thank you. Julian, how can we help you?
No worries. So I'm a registered manager for a nursing agency. And I guess my question would be in regards to reporting clinical incidents. So I know we mentioned earlier about allegations of abuse in relation to a person using the service. My question on this is, where we provide to NHS trusts, I was under the impression that they report regardless. So as a registered manager, do I have to come in and report it myself as well?
Mary, are you going to, or two different people? Who wants to answer that question?
Go for it, Daniel.
All right. Okay, thanks. So yes, if it involves staff that you employ, then as the employer, that's your responsibility to provide us with that information. The agency that you supply to might also report it as well, but you must report it to us as the employer of the individual who's involved in that clinical incident.
Wonderful. Thank you so much for that. Really appreciate it.
Thank you.
Thank you, Julian. I apologise for getting your name horrendously wrong. Would anybody else like to ask anything?
I was just going to add in that So you've seen today that we have some notification guidance available for people. We also appreciate that is pretty old now, and we are in the process of actually updating that, and it will include more information. So some of those things like you've just asked about kind of responsibilities to notify, it gives you a bit more information. So that will be coming out in the next few months and gives, like I say, a lot more information about kind of when do you make the different notifications and what exactly you should be including within that, so that we get the right level of detail as well without having to keep coming back and asking you more questions.
That's great, thank you, especially because recently we had a bit of an incident with somebody getting a sharps injury, and we were quite unsure because it was one of our members of staff rather than the patient. The guidance isn't very clear on that needing to be reported or not, because it was our member of staff. We've done our due diligence and our occupational health inquiries afterwards, but the patient came to no harm at all.
Yeah. Well, hopefully, like I say, keep a lookout for that in the next few months, and hopefully that gives a little bit more information.
Thank you so much, really appreciate.
And as Daniel said, it's better to tell us almost too much than not enough. We much more appreciate that, and we'll know that you're getting in contact with us as appropriate. And if it's gone a little bit too far, the caseholder inspector will let you know that too.
And I would say in that particular incident, then if it involves staff, then we would want you to keep a record of it, but it wouldn't be reportable to us because it doesn't involve somebody using the service. If that makes sense.
Yeah, we do keep those type of records anyway for long-term storage in case something happens. But yeah, there was a few of us looking over the guidance, and we were a bit unsure because it's a bit ambiguous, the text. And it was like, okay, do we report it? Do we not report it? And then eventually we contacted the trust. They reported it via reader. So it wasn't really needed for us to report it as well. And it made it clear afterwards. But thank you so much for the clearance, everyone.
Thank you.
Thank you.
Do we have any more? Okay. All it leaves me to say then is thank you very much. Thank you to Mari, to Sharon, I almost forgot your name, Sharon, and Daniel and Anthony in the background doing all the slides for all your work today, and for everybody who's attending. Please make sure, if you aren't sure about anything, contact your caseholding inspector. We want to be able to help you to navigate through this if it's your first time. So thank you very much, everybody, for attending today, and this will be online within the next week or so. Thank you.